I've known Marilyn Tavenner for 25 years, and I think while we may disagree about the effectiveness of the Affordable Care Act, we do know one thing: we want CMS to be the most efficient, effective organization possible. And I really want to commend the senator from Utah for his strong endorsement of Marilyn Tavenner. I think he spoke eloquently about her background, and I'm going to try to add a few comments, but I didn't want him to get away without my thanking him for his comments. So, Mr. President, I rise today to join this bipartisan show of support for the President's nominee to lead the Center for Medicare and Medicaid Services, Marilyn Tavenner. She comes to the floor this afternoon on a fairly unusual circumstance, considering some of the nominees we are considering. She came actually with a unanimous voice vote from the Senate Finance Committee. She is supported by a number of healthcare organizations and professionals, including the American Hospital Association, the SEIU, the American Nurses Association, just to name a few. As I mentioned already, I've known Marilyn Tavenner for 25 years. She's the real deal, and she will be a phenomenal choice to continue to lead CMS. Marilyn grew up in a small town in Southside, Virginia, and worked her way through school. She began her career in healthcare, not as a hospital administrator or an executive, but she began on the front lines as an emergency room nurse. But then, through her ability and ability to relate to people and care, she rose to become CEO of a hospital and then a senior executive of a leading healthcare company. I know as governor, I called upon Marilyn on a repeated basis on healthcare issues that affected Virginia. Marilyn has always been committed to people and public service, and she took that private sector knowledge and experience into the public sector even before her tenure with this administration, when she joined my good friend and the junior senator from Virginia, Tim Kaine, when he became governor, and served with his administration as the Virginia Secretary of Health. Today, Marilyn has already served at the highest levels of CMS, where she's shown her ability to manage and operate one of the largest and most complex agencies in our whole government. By spending most of her career in the private sector, she knows the impact that regulations and rules have on the real world, understand the importance of not just achieving a policy goal, but ensuring that it works in practice. As we all know, passing a law like the ACA is a complicated process, and particularly a law like this that has generated as much controversy. That means the role of the administrator of CMS to be even-handed, fact-based, effective, and efficient in implementing the dramatic transformation of the healthcare market that the ACA is going to provide will require a first-class administrator, somebody who understands how to get things done, and somebody who is well-respected by both sides of the aisle. Marilyn Tavenner clearly fits that bill. She is held in extraordinarily high esteem. We've again heard the ranking member on the Finance Committee already speak in support of her. She received unanimous support from the Finance Committee, but she's also held in extraordinarily high esteem by her peers. Matter of fact, in February, all of the previous living Senate-confirmed administrators of the CMS, Democrats, Republicans, Independents, all of them who've run the organization agency in the past, all sent a letter urging her confirmation, noting, quote, "It was hard to imagine a candidate more worthy of bipartisan support." So I look forward to voting with, I hope, which will be an overwhelming majority of my colleagues, to confirm Marilyn for this very important role a little bit later this afternoon.